private healthcare sector help Keir Starmer cut NHS waiting lists? That's what the government are hoping for after a new agreement to more closely link the NHS and the private sector was unveiled today in an attempt to cut waiting times for patients. Ministers say the new deal will improve patient choice as part of plans to end the health backlog. But what does it all mean? Well, the NHS and independent sector partnership agreement will see patients offered a wider choice of providers for tests or scans, including private care, paid for by the state. This will focus on certain specialist treatment areas, including orthopaedics and gynaecology, which face long waiting lists, and in more deprived areas of the country. Some 260,000 women are waiting more than 18 weeks for gynaecology treatment, while more than 40% of orthopaedics patients wait longer than the 18-week target. This could see an additional 1 million appointments a year expected to be delivered for NHS patients. How will this be done? Private providers will have to review their clinical exclusion criteria to ensure as broad a cohort of patients as possible can be treated privately, to avoid only easy procedures being done by the sector. And by March 2027, the NHS app will also be significantly expanded. Along with the Manage Your Referral website, it will become the default route by which patients choose where they wish to be treated. Could it work? Well, it will prove politically controversial, as the Prime Minister acknowledged today. Starmer pledged his government's approach must be totally unburdened by dogma and welcome moves to make the spaces, facilities and resources of private hospitals more readily available to the NHS. He added, "I know some people won't like this, but I make no apologies. I'm not interested in putting ideology before patients, and I'm not interested in moving at the pace of excuses." Health Secretary Wes Streeting added, "If the wealthy can be treated on time, then so should NHS patients." The wider context of all this is the government's overarching aim to meet the NHS standard of 92% of patients in England waiting no longer than 18 weeks for elective treatment. This was unveiled before Christmas and has not been met since 2015. It's an ambitious target for the government and one which the public often cite as one of their top priorities. So any failure to deliver could be politically risky. What do you make of plans to involve the private sector more closely in the NHS? Let us know in the comments and download City AM's free app for more on this story and others.